Hi, I'm Mark Dresner, and this is Partnerships TV, coming to you from the Partnerships in Clinical Trials Conference 20th Anniversary 2011 in Phoenix, Arizona. Joining us today is Vijay Govindarajan, Founding Director of the Center for Global Leadership at the Tuck School of Business at Dartmouth College and co-author of The Other Side of Innovation, Solving the Execution Challenge. Vijay, thank you for joining us today.
Thank you.
You gave a presentation this morning, which is what I want to start off on. In your talk, you predicted that one of the biggest innovation in pharmaceuticals will come from emerging markets. What leads you to this conclusion, and can you elaborate?
You see, when you look at emerging markets, there are 5.6 billion people in what we would call poor countries. Mm-hmm. That's a lot of consumers. Out of the 5.5 billion consumers, we currently cater to 10% of them. So there are 5 billion consumers out there who do not have access to healthcare. Mm-hmm. But they cannot afford the healthcare that we provide to the rich. Therefore, the only way you can deal with that is through innovation. Mm-hmm. And that is probably the most significant opportunity for pharma companies.
Mm-hmm. Mm-hmm. Okay. And you actually also predicted that telemedicine in particular was going to become a dominant force in emerging markets like India and China, which are, of course, of great interest to the pharmaceutical industry. What is this going to mean, if I could ask, for clinical outsourcing research in these markets?
I think this, let's just step back and say why telemedicine is going to be such a big force there. You know, there are so many patients that you need to treat in a country like India, yet you have so few doctors, certainly so few specialists. And therefore, the only way we can handle this is through telemedicine, because you can have the specialist sitting in large cities, mm-hmm. but you're able to beam stuff from rural areas into those specialists. And one thing India has is digital technologies and IT infrastructure. I predict intranet is going to change India the same way automobile changed this country. Think about how automobile just fundamentally changed this country. That's what you're going to see in India.
Fascinating, fascinating. And for clinical trials, what will that mean by, you know?
I think, again, when we have this ability to connect through digital technologies, we can do clinical trials there, outsource it, and analyze the results here. Mm-hmm. This would be a great way for us to do very high quality, low cost clinical trials in those markets.
Fantastic. And interesting that you brought up cost. Earlier in your presentation, you mentioned cost, you mentioned quality, and you mentioned access. And you said that these are not only possible, but indeed inevitable in these emerging markets where the healthcare models historically have felt that, you know, quite the opposite was true. You had a great comparison of, as an example, cataract surgery and heart surgery costs in the U.S. Versus innovative, you know, similar procedures in emerging markets. Can you elaborate on this for me?
You see, one of the things that people mistake in this country, if you look at what healthcare has, the business model we had in healthcare industry is medicine and quality of outcome is paramount. Mm-hmm. Cost is not that important because human lives are involved. I think healthcare industry will go through a transformation where cost will become the primary concern while having an adequate level of outcomes as a constraint. If cost becomes a big issue, where else to look for than emerging markets? Because that is where you're going to have low cost innovations come from. Mm-hmm. And incidentally, low cost does not mean poor quality. In fact, Harvard Medical School and Johns Hopkins Medical School are visiting this Arvind Eye Care, which is doing the $30 cataract surgery, right. Or the NH Hospital, which is doing open heart surgery for $2,000. The model they have used is the McDonald's model. Mm-hmm. High volume, thereby drop the costs, still maintaining high quality. Mm-hmm. We somehow assume high volume and medicine doesn't go together. That's because outmoded thinking of keeping this quality is the only thing and we are willing to pay any amount of cost. That's outmoded thinking. Just as an example, this NH hospital, the $2,000 surgery, because they do so many of them, actually they're at the cutting edge because they do so many of them. And this hospital has figured out, typically open heart surgery is one where you stop the heart. and put the heart in heart-lung machine, very expensive heart-lung machine. And then you do operate on the heart muscle, and then you reactivate the heart. They didn't have ability to buy that very expensive heart-lung machine. Therefore, they perfected a way by which to do open heart surgery on beating hearts. And this is a cutting-edge technology, which the Harvard Medical School folks are going and saying, how are you able to do beating heart surgeries? And so, therefore, they're at the cutting edge and at a lower cost.
And just for our audience, we're talking about a $2,000 open heart surgery versus about $50,000 in the States. A $30 cataract procedure versus what?
$3,000.
$3,000 in the States. It's pretty extraordinary. So indeed, it is possible, clearly, to have that quality, to have that access, and to have the cost low. You made an interesting comparison, by the way, between automotive and pharma. Would you care to elaborate a little bit on that in terms of the success in emerging markets, and also on how westernized countries tend to misread some of these markets?
You see, the fundamental problem with westernized companies is they try to find a market in India for their transplanted global strategy. Mm-hmm. You are lost because you need instead to find a strategy for that market. And this is consistently the problem, whether it is US automobile companies, they're trying to find a market for their current set of products, then the market becomes very small. Mm-hmm. And I just came back from India. Let me give you one anecdote which is fascinating. I was talking to the CEO of Kellogg's, which is a very, very famous brand here. They make cornflakes and so on and so forth. The CEO of Kellogg's in India, she was telling me Kellogg's has been in India for 25 years. Still, it only makes $15 million sales revenue. And she was wondering, why is it that we are struggling? Despite the fact we make cornflakes, we adapted the cornflakes and make mango cornflakes and banana cornflakes, etc. I told her, have you ever gone and seen how Indians eat breakfast? It is a big breakfast market. Mm-hmm. For instance, Indians like hot breakfast. So you pour hot milk on cornflakes. I don't care whether it is plain cornflakes or banana cornflakes or mango cornflakes, it becomes a mush. Who the hell wants to eat that crap? So the only people who are eating your cornflakes are people who pour cold milk, just like the way we do it in the US. So someone, the CEO of Kellogg sitting in Chicago is saying, well, $15 million sales revenue in India is okay. Once Indians become more civilized and start using cold milk, they'll come to my cornflakes. Now, this is the problem. Mm-hmm. We are trying to find a market in India for our transplanted global products, right, and then say Indians are not modern to really come to us. Who defines modernity is the question. Right. Who defines who is civilized? And this is the kind of sort of ethnocentric thinking we need to get away from if we really want to compete.
Interesting, very interesting. One last thing, and this I really liked this because when we're talking about innovation, obviously pharma is clearly at a crossroads, especially when we're looking at emerging markets. Next practices, not best practices. In fact, you basically said they're almost the reverse in one of your examples. Can you elaborate on that?
Let me elaborate on that by taking an example from sports. Mm-hmm. I don't know whether you watch sports. I'm a big sports buff. Okay. Winter Olympics in 2008, the person who won the snowboarding event is Shaun White. Mm-hmm. And snowboarding is one of those high degree of difficulty events because it's kind of one of those things, half pipe, there is a half pipe of ice. Sure. You kind of skate on this ice and come up in the air, do a twist, come right back up and go. It's a very high degree of difficulty event. Mm-hmm. You get 3 tries. Even before Shaun White went for the 3rd try, the coach, he had already won the gold medal because everybody else has done their 3 tries. And the best score at that time, the second best score was 41 out of 50. Shaun White had already scored 46 out of 50 in his 2nd try. So he already won the gold before he had to go for the 3rd try. And even the coach tells him on national television, Shaun, we got what we came here for. Let's go home. Mm-hmm. We got the gold medal. And the reason he was saying that is the high degree of difficulty sports where potential for injury is very high. Mm-hmm. He didn't want him to do a 3rd try and get injured because a lot of endorsement dollars are riding on him.
Right.
Instead of, if he was a best practices benchmarker, Shaun White would have gone home. Because if you best practice benchmark, the next person is 41. Yeah. Instead, he said, I'm going to go for 50 out of 50. Now, going for 50 out of 50 doesn't mean he's going to win another gold medal, but he just sort of redefined performance.
Right.
And he did what is called double twist, which has never even been thought of, which is go up in the air and do two twists and land, which is what next practice is all about. Next practices is what gets you to greatness. Best practices is gets you to adopt to the current best. We don't want to be the current best. We want to be the future best.
And right now, what the conventional wisdom is best practices is benchmarking against competitors, and that seems to be what's stifling innovation is essentially your
Because
point.
that is part of the reason why American companies struggle in emerging markets. They take their historical best practices and apply it in India or China. But India and China do not want your historical best practice. They want next practice.
Right.
That's why we struggle.
See, makes perfect sense. Well, Vijay, thank you very much for joining us today. It's a pleasure speaking with you, and you've given us quite a bit to think about. I really need to reassess the way that we go at things, the entire process of our thinking. I think on that note, we're going to conclude this session of Partnerships TV, and please stay tuned for our next episode. This is Mark Dresner signing off. Take care, folks.